Welcome everybody to this event. We're very excited about this series that we're launching today, our first in a number of episodes about drug reform in Colombia. Obviously, it has implications beyond Colombia, and it is the intention of the current president of Colombia, Gustavo Petro, that it does have ramifications well beyond Colombia. He has said that any number of times. Drug reform was a principle plank of his in his campaign. He did not shy away from it, nor has he shied away from it since he's been elected president. His vice president, Frankel Marquez, has been around the world, or certainly through the hemisphere, talking specifically about this issue, obviously other issues, but this has been one of the lead talking points that she had. So this is, for the first time, become front and center, not just in Colombia, but in Latin America, and with the presidency that wants to take drug reform seriously and sees it as integral to an overall view of what he wants to do for the country and its intricacy, its involvement, interconnection with the other things he wants to do. We're very, very pleased to be presenting this series with Ana Arjona, a wonderful professor and expert at Northwestern University, and she's also the creator of Redes Dal. I think creator is a correct word, Ana, if certainly, who has helped us put this together with wonderful panelists. As I say, this is just the first of a number of episodes we're going to do. And we're starting it off this time with our panelists that we have, because each of them were instrumental in putting together a memorandum to the national government in Colombia for drug reform laws. And it has, their suggestion is that is a roadmap for the government to follow. They are the leading advocates for these issues, not just the advocates, but the leading experts in Colombia about these issues. So we're pleased to have them with us. And I'll turn it over to you in just one second, just to say to everybody, if you have a question or a comment, but preferably a question, if you could please keep it short and put it in the question and answer box. We will do our best to integrate them into our event today. We have a lot of material to cover, so if your question doesn't get answered, please understand that we tried, but time limitations prevented us from doing it. So I hate to give apologies in advance, but I'll do that anyway. With that, Ana, why don't I turn it over to you to present today's theme and introduce the panelists. Thank you.
Thank you, Ken. Welcome, everyone. As Ken said, my name is Ana Arjona. I'm a professor of political science at Northwestern University and the director of Redes Dal, the network for the studies on drugs in Latin America. So in this first seminar, we will be discussing the proposals that several organizations put forward in a memorandum that was really responding sort of to the critical space that has given to drug policy by the current administration. It is an important moment for Colombia and for Latin America, we think. There is a space for a lot of consideration of what has gone wrong with drug policy, what is the space for reform. And we do think it's a very unique moment to push the debate, to try to learn from research and the evidence and from the organizations, the scholars that have been working on these issues, and try to see, based on what we know so far, again, based on this research, what makes sense to change and how can we think of better drug policies. And so in Colombia, I think what happened with the memorandum is a very unique moment where different organizations that may differ on some issues, but that have all been working for a long time on trying to understand drug markets, from the production, the growing of coca or marijuana, to the trafficking, to the consumption, came together and tried to say, okay, based on what we know, based on the research that has been conducted, what makes sense? And I, as a scholar, I have to say that one of the strengths of this memorandum is that they are not just thinking of what are the ideals and let's forget about all the practical or pragmatic issues, but no, let's be realistic. And I think that's where there is a very good and relevant and needed bridge between what scholars usually do and what organizations that are also looking into sort of the the workings of policy and public opinion and institutional setup and bureaucracy can do to further this debate. And so I'm very happy to come together with the Department of Political Science, Redesdal, and the council to think about this, to bring these debates also outside of Colombia. I think in Colombia there was a lot of conversation about the signals that the government has been given about what may or may not happen, and there was some coverage of the memorandum. We are not sure, and with Ken we talked a lot about this, about international audiences really hearing about these proposals and trying to think together. We also think that this is useful beyond Colombia. So before we start the panel, I wanted to invite you and stay tuned. We will have another seminar in the second week of November, where we plan to think with experts on different countries in Latin America about the policies that make sense to push as a region, right? What makes sense to implement, or what is the form that these reforms should take if we think of the different countries and sort of the similarities and differences across cases. So let's start with the panel. Let me introduce the speakers. We have María Alejandra Veléz. She's the director of CESED, the Center for the Study of Crime and Drugs at Los Andes University. She's also a professor at the School of Economics at that university. Isabel Pereira is the deputy director of Dejusticia, a very well-known, excellent organization that works on a number of issues related to justice and that has a long history of thinking about drug policy. And then we have as a discussant Santiago Tobón. He's a professor of economics at EAFIT in Medellin, Colombia, and also a visiting professor at the University of Chicago. And he has done a lot of work on crime, on violence, and violence linked to drugs and drug markets. So without further ado, we're going to start. María Alejandra is going to talk first about the memorandum. Isabel is going to talk next, and then we will have Santiago's comments, and we'll have an open conversation. Thank you, María Alejandra, the floor is yours.
Thank you, Anna and Ken, for putting together this session. I'm really happy to be presenting this work. I'm going to share my screen. I have prepared like a presentation, so it's easy to get to the point. So as Anna just mentioned, we put together this memorandum right at the moment when the government Petro started, because his announcement about a new drug policy agenda. So we thought it was useful to get like a roadmap in order to really define the steps that we need to take in the short, medium, and long term in order to really change the towards a new drug policy, because it's not going to be easy anyway. So just to mention briefly, who are these organizations that get together? We were 6 organizations that were like research centers, such as CESED and Dejusticia, but also NGOs and other independent think tanks like the FIP, that we sort of got together and agree on what are the next steps that the government need to take. Before going into the details of the memorandum, just to probably most of the audience know this data, but I just wanted to have like a starting point so we are in the same page on why we need to change the drug policy. So very briefly, all of you may know that, but Colombia produced almost 70% of the total cocaine consumed in the world. So it's a big player in this, of course. The last report of United Nations mentioned that we have 204,000 hectares of coca, which is the highest level of coca crops in the series since 1999. And basically, the cocaine market is estimated to be 2% of Colombia's GDP. Cocaine productivity continue increasing, so it's not only about the hectares of coca. 1 out of every 4 detentions were drug-related in Colombia, and we think that drug policy costs have been disproportionately faced by vulnerable populations. So we need to change that in a context in which basically we have an estimation of 20 million cocaine consumers worldwide. So it's a demand that is stable, increasing, and basically countries are facing the cost of the war. So I think that all of the organizations who signed this memorandum agree that drug policy has been basically a static bike, that we are not getting anywhere, and we need to change that. So the memorandum basically start, by presenting recommendations that are aiming to save lives in Colombia. But we think that the government needs a coherent communication for the new drug policy. Basically, there has been a lot of announcements, but it's not clear the route. So in this memorandum, as Anna said, we identify key actions in the short, medium, and long term, because we understand that we need to do a lot of things before we get to the final point, which is probably regulation of all drugs, including cocaine. But we start by reforms at the national level, with reforms that do not affect international relations. We understand that Colombia cannot tomorrow regulate cocaine because it has to be an international agreement. It has to be part of the bilateral relations, and we are clear on that. So basically, we cover several topics, including institutional reform, territorial transformation, regulation, international relations, public health, and prisons, and some other points. I'm going to start with the three first points, and then Isabel will cover the other ones. So in the first short term of government, we talk about several institutional reforms that are needed. The institutions that are working towards drug policy in Colombia are very dispersed. So the first thing that we think is that we need to create directions at the agricultural, health, and foreign affairs ministers, and also the National Planning Department. And we need an institutional framework that must be articulated at the highest government level. So right now, really, the drug policy is led by the Minister of Defense and the Minister of Justice. And the other ministers, such as the agricultural, doesn't have anything to do. And I think the coca crop issue, it's an agricultural problem. The government so far hasn't gathered the National Narcotics Council, which is the agency that needs to define the strategy of the national reforms. So those are like steps that we need to take before even talking about other things. In the short term, we think that the priority should be regulation of cannabis. We haven't even covered that part, and cannabis production in some regions of the country are really feeding the violence there, such as in the norte del Cauca. So we need to, that should be the priority. We can actually learn a lot of that from that, how we're going to distribute the license, etc. And the government must organize the legislative initiatives and define a consistent narrative. Right now, there are like 5 law proposals in the Congress that need to be organized and need to be led by the government. On the front of coca crops, even though this government has announced that they're not gonna continue with aerial spraying or aerial eradication, the decree that regulates that is still in place. So we need to revoke that decree in order to eliminate this strategy that all the studies show that is not cost effective. The war against drug has prevented the research and the products that can be developed based on coca leaves. So we need to review the current mechanisms for approving ethnic products, including those based on coca leaf, but also cannabis, to get a license to have a production of coca tea leaves, coca infusion is very difficult. So we need to review those mechanisms. Perhaps, I mean, Petro's government announced at the beginning that he was going to change completely drug policy, but the truth is that now he has announced that they're gonna continue with the national program for the substitution of illicit crops, PENIS in Spanish. And this program, it has had a lot of failures and problems during its implementation in the past 6 years. So we need to define the continuity, the adjustments, and the scope of this substitution program, and include a lot of new things. We need to bring back the participation forums so cocaleros can participate in the design of the program. I think that a really a new thing for this program will be to apply the concept of gradual illicit crop reduction. You know, the rule of total eradication before cocaleros can join the program is not feasible, basically. So we need to apply the concept of gradual illicit crops. We need to develop short-term agreements to reduce illicit crop expansion based on community monitoring. And I think that the Bolivian social control model is an interesting starting point. Our studies show that when cocaleros signed the agreements to join the program of substitution, the violence against social leaders increased in 400%. So we need to have like a security plan, implement context analysis, strategy analysis to reduce violence in those areas. I mean, when you intervene the territory with a lot of armed groups in place, it has unintended effects. So one of the lines of the substitution program should be the protection of leaders. We need to, of course, focus beyond crop substitution, and we need to be thinking about territorial transformation, including a link with the territorial level development plans. We need to include land formalization, and we need to have an environmental perspective. Right now, 50% of the coca crops are in strategic environmental areas. So even in the regulation world, we need to start thinking the environmental impacts of this market. We think that in order to start changing a drug policy agenda, we need to design a drug policy training and development program for public officials with a special emphasis of the police force. We have a police force that has been doing the same drug war against drug for the last 50 years, and we need to have a program to provide information and a new narrative for drug policy. Finally, we need to establish the roadmap for rural development interventions in the context of those territories that are controlled by other illegal armed groups. One thing was to do a substitution program of that size in the context of the peace agreement with the FARC. But now how to design a substitution program in the context of other illegal armed groups that are controlling the territory. In the first 6 months, we have to start focusing on the regulation. And as I said before, if the priority is cannabis, we need to start defining the design of this cannabis market to reduce the illegal informal market. We have to think about that the license for the cannabis production should be directed to protect public health, but also to favor the indigenous and local small farmers who previously produced cannabis. And we think we have to push for the cocaine regulation, but we need to promote a national and international debate on the regulation of cocaine to get into those details of how to design a regulated market for these and other substances. We understand that this has to be an international initiative to really eliminate the illegal market. I mean, there is other details for the midterm for the institution, that this national narcotic instance needs to define and detail the whole strategy. We need to enhance the capacity of the drug observatory. We need to start producing data on the national survey of consumption, and this probably should be conducted by the Administrative Department of Statistics, DANE, so we can guarantee a regular survey. And finally, in the long term, I think this government needs to connect the drug policy reform with the government's total peace proposal. We really think that without regulation of drugs, there won't be peace, or it won't be total. So this total peace proposal needs to be connected with the regulation policy. And I think that the cannabis market should be the pilot in order to build a market, a legal market for cocaine, including how to distribute the license of the producers. So I think I'm going to stop there and pass the ball to Isabel.
Good. So good morning, everyone, and thank you to Anna, to everyone at the Canadian Council for the invitation. I will also be sharing my screen and hopefully be mindful of the time. But what I will do is cover some other topics within the memorandum that to complement what María Alejandra has already said. So firstly, my name is Isabel Pereira. I come from Dejusticia, a human rights NGO based in Bogota. And I will be covering three main areas, on criminal policy and incarceration, on public health, and on international relations. But before that, I wanted to note that also part of the idea of the memorandum is how to get a balance between two complicated issues in this unique moment, as Anna mentioned. So one is how to manage expectations between a government that is suggesting such bold changes and have changes to be feasible enough to really tackle the problems that we've been facing with regards to drug policy and prohibition. And it's a huge task, and we really don't want to get to a point where disappointment is so big that we had our hopes into reform coming into this government and not be able to focus government effort on what can really be what can really have a domino effect and have an aim at structural changes. So with that, I'll start with criminal policy. And this one is the section into which I'll have a bit more data, because we do have more data into what is happening in prison systems and incarceration. A bit of normative context. And this is related to one of the questions that already came in through the chat. So personal use, as you know, is decriminalized in Colombia since 1994, different to other countries, for example, in the US, where sole possession of drugs carries criminal offenses and prison sentences. In Colombia, personal use has been decriminalized since a very historic ruling from the Constitutional Court. But that does not mean there is a peaceful relationship between law enforcement and people who use drugs, specifically because there are administrative sanctions included in the police code. So referring to the question presented in the chat by Mauricio, yes, police officers can detain, confiscate the drugs, and present fines to those using drugs in public spaces. There is some sort of administrative sanctions. But then what we do have is a criminal code that is very ample and big in the way it defines drug trafficking crimes. So there's one article in the criminal code, Article 376, that has more or less like 40 verbs that describe what can be a criminal sanction related to drug trafficking. So what this leads to is disproportionate incarceration and overcrowding in prisons. Partially due to this, the Constitutional Court has ruled the prison system as in a state of unconstitutional affairs. There have been two rulings stating this same situation. What this figure means, state of unconstitutional affairs, is a figure that the Constitutional Court used wherever it identifies there is a massive and systematic violation of human rights to a specific population, context, or due to the implementation of policies. This has happened, for example, with the situation of ex-combatants. That was the most recent state of unconstitutional affairs ruled last year. The situation around internally displaced populations also had a ruling to this effect, and it creates a mechanism to follow up and change policies so that we can overcome that state of unconstitutional affairs. In the case of prison systems, one of the things that the court stated is that one of the roots of overcrowding in prisons is a criminal policy rooted in populism and that presents disproportionate sanctions and generates overcrowded. And lastly, the Truth Commission very much aligned with what experts have said for decades now, is that there is a need to rationalize the use of penal sanctions with relation to drug offenses. And where possible, decarcerate those people who are now in prisons and that were persecuted for low-level nonviolent offenses. So a bit of context on this, because as I've mentioned, this is the one of the topics where we have more robust data. This is from a pretty kind of old study in 2015. Back then, all of women, out of the total women population in prisons, 45% were there for drug offenses. This proportion doesn't vary much. You get 45%, 48%, depending on the year, but it's roughly half of the women prison population. And of that group, of the 45%, 81% had no violence in the crime they committed, and no relation with the criminal network was proven. So what this really tells us is that the people, and the women specifically, who are in prison for a drug trafficking offense in this ample criminal classification that I mentioned before, are women who are doing very, very simple transactions in their drug economy, like just passing packages from one hand to another, but really had no power, no resources within the criminal organization. And related to this generates like a domino effect within families that are in great states of poverty. So what we have, oh, sorry, I left this. So what we have is that of the women who were imprisoned for drug offenses, 76% were working in the informal economy. So what we're talking about is a population that has very low access to any kind of social mobility. 22% had not even finished primary school. Also, they come from backgrounds with large percentages of being victims of gender-based violence. And they are also the ones whose their household depend on, and they have large household. On average, all of them have had 3 children, and 60% of them had their first pregnancy as a minor. So again, we have a large population, and this population has no power within the criminal ranks, and then we're just perpetuating cycles of poverty. So one of the main recommendations from the Truth Commission and from many other institutions, including our memorandum, is that we really need to tackle this in order to overcome prison overcrowding. So in terms of the recommendation regarding criminal policy, within the first 100 days, we have recommended to convene the National Criminal Policy Council. But yesterday, as I was preparing this, I realized that the first 100 days basically are about to be happening. So maybe, as we've mentioned with María Alejandra, this is sort of a moving document. Every day we look at it, some things might have changed or might be pressing to mention. The National Criminal Policy Council is a body that the government has to have them advise the legal reforms needed with regards to criminal policy. And this council has not convened during the Duque administration, and I believe it didn't convene. And now they're setting it up again. And one of the recommendations is how to rationalize the use of prison systems and really implement alternatives to incarceration. And this relates to our recommendation within the first 6 months. The first one we have is to sign and enact this bill, Bill 093 of 2009. This is a bill presented in Congress to incorporate alternatives to incarceration for people who are in prisons now for low-level nonviolent offenses and are head of households, which are mostly women, but it can also be applied to men. Anyone who qualifies this category of a nonviolent offense and being responsible for their household, and really link them within the alternative to incarceration to services of employability, education, and training. And that is our second recommendation within the first 6 months. So this bill was already signed, reviewed by the Constitutional Court and approved, but it needs to be signed in order to get to implementation. And we really urge the Ministry of Justice to move forward with this. And then in the midterm, there is a need to set new success indicators. Thinking again about the question that was posed in the comments. So police officers, either informally or formally, have incentives to catch many people on the streets with marijuana quantities, because that is something that they can show us as success. But what does it mean to have success in criminal policy? It should mean that we're dismantling criminal organized groups and really tackling where money and power is. And that is not on the streets where people are doing activities that are not in that high level of criminal activity. And then the second recommendation is a big one because we do need to reform our criminal code and our national narcotic statute. So the criminal code is the one where this offense that I described earlier is situated. The way this crime is formulated just allows for a lot of disproportionate sanctioning. And also because this crime is not allowed to have alternatives to incarceration, anyone involved in any type of activity related drugs, just passing someone from hand to hand, will have a prison sanction. So we do consider it's important to reform the criminal code. And our national narcotic statute is clearly outdated. It's from 1986. So if we're going to move with reform, we really need to start there. And this relates to the institution bit that María Alejandra presented. And then lastly, we need to submit a coca leaf bill to decriminalize small crop producers. This is one other thing that is criminalized in Colombia, the cultivation of coca. And this leads to very complicated relationships between the state and cocaleros. And also it doesn't really recognize or respect traditional uses of coca leaf, which is present in Colombia in many indigenous communities. Then I'm going to move to the public health issues. And here, different to the criminal policy bit, we don't have that much data. The issue there in public health is the lack of data. It's a overarching lack of data. So we don't have very robust data of what kind of substances, illicit substances people are using, what are the patterns of use, like in trends, age of when they start to use, rate of consumption, and what are the various effects in different stages. So the epidemiological aspect of drug use, we don't have robust data. For example, if the police is confiscating drugs on the street, the analysis of those substances could lead to better information of what people are using. But we don't have that kind of information. Also, there is a neglect on harm reduction interventions specific towards women who use drugs. This is completely overlooked, and there is a field to be explored there. And harm reduction programs in itself are very underfunded and dependent on civil society, international donors, or local governments that are willing to do that. Although we do have a national public policy that supports harm reduction and has a clear and positive idea of harm reduction and is not criminalized as it is in other countries, because there is no consistent funding, then harm reduction interventions are very intermittent. And that is very dangerous in terms of lives themselves. As María Alejandra says, what we recommend here is, because it is a matter of saving lives. When you have, for example, distribution of naloxone, which is the substance that can reverse heroin overdose. When that distribution is present 1 month and then it stops the next 8 months, you're setting up for people to die on the streets. And there needs to be consistent and permanent funding to harm reduction programs, and not be at the will of whatever voluntary programs may happen. Then also there is a weak implementation of the medicinal cannabis law. This law was passed in the previous government in 2015, but there's still a lot of loopholes and a lot of and very few accessibility and availability internally, domestically, for medicinal cannabis. And this is an opportunity in the country that has not been explored enough. Lastly, as elsewhere in the world, in most of the world, there's persistent barriers in access to controlled medicines. So basically, opioids that are used both in substitution therapy for those who are dependent on heroin, and also opioids that are used in palliative care and end of life. That availability and distribution is concentrated in large cities, so basically in capital cities, and there come times during the year where there are no medicines left, so people are left with avoidable pains. And this is something that is really overlooked when we talk about drug policy. We tend to think about drug trafficking and the illegality of it, but we forget the fact that the treaties supposedly were to guarantee the accessibility and availability of those substances for medicinal and scientific purposes, and that goal is not happening. So what we recommend in terms of public health, although this this first recommendation is kind of public health, but it's also criminal policy, is to revoke Decree 1844 of 2008. And Decree 1844 was the one presented by Duque during the first months of his presidency to reinforce criminal sanctions, administrative sanctions for those using substances in public spaces. It is a matter of public health, because when you have people who use drugs be chased by the police, this really tends to promote unsafer drug using practices. But it is also related to criminal policy and police reform. It is a merge of the two. Then to promote the implementation of the 10-year public health plan, this has some good provisions about the intersection between drug use and mental health, but its implementation is kind of, we need them to really set up what is going to happen with this implementation. And then also promote measures to ensure access to medicinal cannabis. In the first 6 months, we do believe that there's a vast information that could be started, that we could start together. For example, what I was mentioning about the drugs being available on the streets and confiscated by the police, that we could start programs to test samples of these street drugs, and from that information, develop better public health decisions. It is really difficult to design public policy with regard to drug use when we don't even know what people are using. So we really need to start by sampling what is being used on the street, and from that, design public health intervention. And this links to designing a risk and pleasure management strategy. We do believe that the issue that we focus only on risks really limits the possibilities that harm reduction has to offer. It is also about pleasure. People use drugs for the pleasure that it gives for socialization purposes within festivals. So really fund and implement those plans of testing illicit substances in festivals, in concerts, ensure minimum access to water and hydration. In the medium term, we're a bit more ambitious in how Colombia might run with this. Supervised consumption sites, which are an intervention that started in Canada and has proven to be very successful, is something that Colombia should move forward with, at least with pilots. Where relevant, in those places where we know, for example, that there is injected drug use, there should be a start to those pilots and really try to see how it would work in the Colombian context. Also design strategies to reduce or eliminate access barriers to these medicines I was mentioning before for pain management and the flag, and encourage research. And actually another one that I'm thinking of is that the high impact substance in Colombia is bazuco, crack cocaine, especially people who have problematic use. But we don't have a lot of research on what harm reduction strategies would look like for this kind of substances, and Colombia could lead the way. Then lastly, I'll move to international relations, and this is a lot briefer. So we come from a period of a total abandonment of the reformist approach. The 4 years of the Duque government went back to a voice of Colombia in the international arena, really just supporting whatever prevalent prohibitionist approach was. And we lost that regional and international leadership. If the new government is to really move forward with bold reforms such as regulation, it needs to build international support for that. And to build that international support, we need to regain our leadership. This could start by really moving forward in the natural spaces, which are Geneva, Vienna, and New York. And there is a pending promise from the peace agreement. The peace agreement in the drug chapter of it promised or committed to having an international conference to review the current international paradigm on drug prohibition. And that conference has never happened. So it could be an auspicious moment to uptake that. And then also the recommendation of the Truth Commission, which is framed as a regulation recommendation, does include that Colombia leads the way in this international conversation, and including a conversation to transit towards regulation and reform the treaties. This comes from the Truth Commission. So our recommendations are basically in the first days, it's the immediate our most immediate relationship with the US, of course, and really how it dictates our national policy. We have goals with the US government to reduce by 50% coca hectares, but we believe that hectares in themselves tell us nothing about socioeconomic development and really the situation of people who grow coca, and we need to renegotiate these goals. And then in the medium term, we need to prepare Colombia's presidency to the Commission on Narcotic Drugs. It seems to be that Colombia will be taking the presidency of this committee in Vienna for the participation in the March session. And of course, as I've said before, restart regional and international leadership. In the medium term, we do expect this government retakes the promise from the peace agreement and holds the international conference. And also, if we're moving forward with regulation of cannabis, there are a number of jurisdictions that have at least 5 or 10 years of experience with regulation, and we need to learn from these models and engage in international relations with this country to learn from this. Then in the long term, lead the review and the international conventions, but we know how that panned out in the past, so this is a bit more the ambitious one. And on that note, I will finish. Looking forward to your questions and the discussion. Thank you very much.
Thank you very much, María Alejandra and Isabel. That was fantastic. Santiago, the floor is yours.
Thank you, Ana. Let me just also share some slides that I have. Let me know if you can see them well. Okay. All right. So thank you very much, Ana and Ken, for putting together the panel, and thank you especially also to María Alejandra and Isabel and all the rest of the contributors for such an outstanding work. I'm very, very impressed because of the level of detail and many other attributes that I will elaborate a bit more on this discussion. So I'll just start with some of the main strengths that I see with this document, which is not by any means a comprehensive list. I think there are so many that I wouldn't have enough time to actually list them all. The first one is that I believe this is like a very comprehensive plan with a number of different positive attributes. For instance, in my opinion, it aggregates the preferences of many communities that have been systematically kept out of the drug policy discussion, which is very important. Also, and evidently because of how the title explicitly mentions, it outlines a new drug policy and one that changes the focus from law enforcement to public health in a very formal and explicit way. Another key attribute is that it provides detailed instructions on how to proceed, and what is relevant here is that it accounts for several policy areas. So Isabel and María Alejandra already went through them, but institutions and rules of the game, the agenda on foreign relations, public health and coexistence, as well as many others. Also, another key attribute is that it has a reasonable time structure. I think that having these periods of 100 days, 6 months, medium term, long term, helps people understand what are the steps to follow to try to implement something like this. And perhaps the most important attribute I would say is that because I think so, because this is often the missing ingredient in drug policy, is that it sets out a step-by-step plan towards regulation. And why is this important? Because I think this shifts the typical policy discussion from the extreme possibilities, from full prohibition to full legalization, to a non-discrete conversation that allows to overcome many of the political economy problems that regulation implies. And perhaps one final key additional point is that this is a very specific set of recommendations with direct guidance, specific decrees, specific laws. So in principle, this should be kind of the dream of any policymaker that wants to move forward with something like this. A second strength is that I think there are I would say some points, some recommendations that I would like to highlight because of the transformative power that they have. So that there's a very comprehensive list. So I'm not going to go over all of those that are important, but I do believe that there are some key like specific recommendations that are like pivotal in how the future moves ahead. So the first one is regulating adult use of cocaine quickly. I think this would lead to a number of immediate benefits, would allow us to just change the discussion from from marijuana to more like complex drug markets. And some of the benefits of immediately regulating marijuana are, for instance, that fewer people would have contact with the criminal justice system, including fewer inmates. This would naturally free up resources from the whole system, police time, prosecutor time, public defender time, judge time, prison guard time, prison space, and this is just to name a few. And these resources could be reoriented towards crimes that create large social costs and to prevention, which includes, for instance, education, demand reduction policies, and so on. Also, this would incorporate like one share of the economy that is currently fully invisible, the market of recreational marijuana, but that already exists. And this will have two immediate implications. On the one hand, like tax revenues would increase, and in states such as Illinois in the US that Anna probably knows, and me as well, because of this junctural year that has me here. Revenues from marijuana sales are now higher than revenues from alcohol sales, tax revenues for the state of Illinois. And on the other hand, many workers of the industry will become formal. This implies an immediate change in their well-being, but also even savings for pensions and many other things. And I don't think that all workers will formalize. Of course, I will elaborate on this in a bit, but some might. Another key point of regulating cannabis quickly is that mechanically, the size of the illegal market is reduced, which on the margin should imply less powerful or smaller criminal organizations with fewer members. I think it's perfectly possible that some groups turn to other activities or double down on them, such as extortion. But for instance, in Medellin, where I've been collecting data on more than 400 criminal organizations with a group of colleagues, our sources suggest that local marijuana sales are among the top business lines for all these gangs. Hence, one would expect a rather structural reorganization of the criminal market. And it's hard to believe that such a business line would be easily replaced with another one. And a very important effect, my intuition tells me, is that the reorganization of the criminal market will lead to less violence between groups along two dimensions: actors that are part of the same value chain and actors in different positions in the value chain. And perhaps also importantly, with a smaller criminal market, corruption of public officials should reduce as well. Another key point is drug quality will improve. Probably the environment will benefit, as some areas used for production or trafficking would move to formal land and roads. And finally, but not less important, marijuana regulation will be, I would say, the first step to overcoming many of the political economy problems of cocaine regulation. I think Isabel and María Alejandra already elaborated a bit on this. There are risks, of course, which is perhaps the main argument of those advocating for prohibition, that demand will increase. I think this risk is minimal because of at least two reasons. On the one hand, the shift in policy and resources towards demand policy should mitigate the risk. We might be better able to reduce demand. And on the other hand, although indeed demand might increase by a bit, I don't think the change will be large because almost any person can buy marijuana in less than 30 minutes in major cities and urban centers or in semi-large rural municipalities. Now, like I listed all these benefits of regulating marijuana now, but I think, and the reason why I think this like regulating marijuana is very important is that I'm convinced that if we replace marijuana with cocaine while going over all of these risks and benefits, I think they will hold the same significance. And perhaps the risks are a bit larger because cocaine is a more complex drug than marijuana, but the benefits will also probably have much more significance. And this is why I'm convinced that both marijuana and cocaine regulation are desirable, and why I believe this document is so important for Colombia now. A second point is that like promoting the debate on the regulation of cocaine for recreational consumption through the creation of a commission of experts is really a necessary condition for many of the reforms that are outlined in the document. I'm convinced that one path towards solving some of the fundamental political and economic problems of cocaine regulation is more information. I mentioned before how a step-by-step process that the document has is a key ingredient of a realistic plan for regulation. And one natural first step into this, or in this process, is to have a more informed conversation with, for instance, explicit estimates of social costs and benefits under different normative frameworks that will allow people to judge from a less passionate perspective. So I think it's very important to start with that, and I think that's one of the key strengths that the document has. Like formally triggering the debate on cocaine regulation will facilitate the production of this type of information. I also think that without this step, with involvement, for instance, of the media to disseminate results, the rest of the plan will be very hard to implement. And another strength here is that while many typically, and especially like during these days in Colombia and maybe other countries in the region, worry about bureaucracy or a very large state, I think this should not be the case when it comes to regulation of complex substances. The current institutional capacity is clearly insufficient for an adequate level of regulation that will involve licensing at different stages of the value chain, quality controls in retail markets, demand restrictions in quantity purchased. For instance, in Illinois, there are like limits on how much marijuana one person can buy during some period of time and so on. And to move towards regulation in a relatively controlled way, we definitely need to strengthen institutional capacity. And I think that the document and the roadmap and the policy are not timid here by any means. And this involves creating new offices at different branches in the executive, strengthening the diplomatic representation of Colombia in different places, and retraining, for instance, members of the armed forces and other public agencies. And while some may believe that we cannot like grow our state larger now, I think we can easily reduce the state apparatus in other policy areas that require less regulation and intervention, and rather strengthen this area. And perhaps a final strength that I would like to highlight, again, this is not a comprehensive list of strengths, is that even if someone disagrees with one point here and there, or if there is or if one or several of the points prove more difficult or even impossible to implement, I'm convinced that the efforts to implement this roadmap and policy would lead to a higher aggregate welfare level within Colombia, but most likely also worldwide. I think that even if some of these fails to be implemented, I think we'll be better off than what we are now. And I think that that's also a very important strength. This is a realistic plan that it's not a discrete evaluating whether this can be implemented or not, or afterwards whether this was implemented or not, is not like a discrete choice. It's not 100% or 0%, but rather something more continuous. And now some quick reactions that I believe could potentially improve or complement the proposal. Some of these are kind of small disagreements that I have with the approach, but just things I would say to foster the conversation. The first one is that I understand why it's important to try to bring compensation to communities that have suffered a lot is important right away. But I think I would reduce the emphasis on overregulation of production as a form of compensation. And in particular, this relates to, for instance, the licensing of production first to communities that have been historically producing it rather than to the market altogether. And why I think this is that, for instance, licensing only to original communities, while I understand the clear good intentions again, is perhaps an inferior solution to alternatives such as, for instance, direct economic compensation. The main reason why I believe this is the case is that the excessive protection may over-incentivize entry or permanence in the industry by participants that may face limited capacity to engage in competition in the future, right? And this in turn would require long-term subsidies and other protection mechanisms for less productive firms, let's call them, as it happens now with many sectors, including some agricultural products. And a particular point here is that is the relatively high technology that is currently being used in the US to produce high quality products, marijuana products, in a productive way, which may require prohibitively high levels of investment. So in the long run, it may be that some of these actors are going to face challenges into participating in the market and competing at the same level as other firms. So maybe just direct compensation via subsidies for a long period of time, or many other of these alternatives might be just more efficient than trying to over-incentivize them to stay in the sector. The second, I would switch, at least partially, the emphasis on the more like UN-based or multilateral organization-based approach. I believe a natural first step is to actively push a trilateral conversation between Colombia, the US, and Europe. On the one hand, according to the Drug War Report of 2022, like about 54% of cocaine users of the 21 million that María Alejandra mentioned before are either in North America or Europe. And on the other hand, as also María Alejandra mentioned, according to the same report, about 60-something% of total cocaine is produced in Colombia. So I think that with these three actors, we have most of the market. And I think that I believe that an arrangement between these three parties would be easier than a coordinated effort across a larger number of actors, with each one of those dealing with their internal political economy problems. So maybe I would emphasize more this trilateral conversation in parallel, not necessarily as a substitute of the more like UN-based or multilateral-based, organization-based conversation. A third one is that maybe a complement. In addition to having regular consumption service, I think we also need more systematic data collection processes to understand supply better. We have a very obscure idea on the levels and variation of prices and quality of drugs within and across cities. For instance, we don't know what's the effect of scarcity on cocaine prices. We don't know what's the effect of scarcity on cocaine quality. How are the current like illicit markets being regulated by criminal organizations? We don't know. For instance, from our work in Medellin, we have learned that street gangs are regulated by like meso-level criminal organizations that enforce contracts, regulate prices to avoid competition, and so on. And we don't have a lot of systematic data on this across the country. We don't know how the market structure, who are the main organizations behind production, who are the main wholesalers, the main retailers. How do these value chains work? Like, for instance, we don't know whether the cocaine that you get in the north of Bogota comes from one specific region of the country or not. We don't know if the cocaine that's sold in the northwest of Medellin comes from Cauca or maybe Nariño, or from where it comes. And I think that the US has made a lot of efforts into understanding and like tracking these down better. DEA officers buy drugs to understand prices, to measure quality. And I think we don't do that enough. And we need to do that because I think this type of intelligence will be very important before we get to regulation. But it will also be very important for regulation itself. Like when the state should have the best information possible on the criminal market to search for deals or arrangements with criminal groups. And this is actually like one key challenge that I see on this idea of total peace or paz total, which is that all the cards of the state are on the table, but the cards of the criminal organizations are not on the table because no one has the information. And I think we need to build this information in order to have a more like symmetric conversation with these groups. And finally, one last point. I think one area that perhaps requires more emphasis and is somewhat related to this last point is the investigation capacity on money laundering. Here, I will just summarize a personal anecdote regarding the scope of our current policies in terms of money laundering. Colombia is linked to this, like to the Financial Action Task Force, which is kind of the global money laundering terrorist financing watchdog. And this implies that in general, Colombia follows the recommendations and the standards of this organization. And even if these policy guidelines in what we call COMPES documents are formally incorporate the standards of this organization. So every like COMPES document or policy document that we have in Colombia related to money laundering follows and adopts the standards of this international like organization. Yet a few years ago, I participated in a workshop to discuss which of the prioritized sectors in these standards Colombia should adopt for a new updated COMPES. And the original list of sectors included, for instance, construction, NGOs, or the financial sector. But from, again, our work in Medellin and other cities in Colombia, And Medellin in particular, because this is perhaps the city with the largest money laundering operation in the country. I might be mistaken, but if it's not the first one, it's the second one probably. We know that in addition to some of the priority sectors in these standards, the transport sector is key for money laundering. And the same is true for the hospitality sector with like massive operations in restaurants and hotels. And these sectors were not in the standards. But then the approach that the relevant state agencies in Colombia were following to standards was completely top-down, like started only with the standards, not the context of Colombia, and seldom investigating what was really going on in many parts of the country. So I think like that we need to strengthen that a lot. And that be it. Just to finish this discussion, I would just like to again congratulate everyone who participated in producing these policy recommendations. I think this is a very thorough list of tasks for our society to move forward. Thank you.
Thank you, Santiago. Thank you to all three panels. That really was astoundingly good presentations by all of you. María Alejandra and Isabel, are there any, come around for another round, any comments that you want to make based on what some of the others made, maybe what comments that Santiago had just made? María Alejandra, do you want to jump in?
Yes, sure. Thank you. Well, I have a couple of reaction and comments. Thank you, Santiago, for all your comments. I wish you were one of the high officials who read the memorandum, because I have to admit that we haven't had any reaction from the higher officials of Presidente Petro that we sent the memorandum. And as Santiago said, it's just such a detailed free work for them in order to do the roadmap, and basically we haven't had any reaction. So I have to say that I'm very frustrated by that, and that's a personal note, not in representation of the other organizations. So I'm glad somebody is reading it with that detail. Of course, I agree with your points 2, 3, and 4. I totally agree. I think we should include that. But let me disagree.
Can you remind people what those points were so that people are following? Sorry.
Can you put the information about laundry, with the information about criminal groups, and the focus on bilateral relationships instead of UN-based relationships? So I agree on those points. But I disagree on Santiago's first comment about sort of over-regulation of production as a form of compensation. Like, we somehow in the document have said many times that cannabis license and even cocaine license in the future should be directed towards former or traditional coca farmers and campesinos. And Santiago is saying that it's a bit of over-regulation of production, and basically, I understand his argument in terms of the efficiency in the long run, but I do believe that right now I have to sacrifice efficiency in the equity terms, like what happened with the exclusion of former peasants in the cannabis medicinal market. It basically can't happen anymore, because even though I think the drugs, the legal drugs are feeding the war, I think that inequality is in the roots of our problems, and I think this is an important moment to basically compensate this exclusion, but also the war against drugs. And if we don't include them in these new legal markets, then they're gonna shift to another illegal market, because it's the only market that they have experience or knowledge in. So I do think we have to sacrifice maybe efficiency in the long run. So we have a system in which former peasants are included in the market. So that's like my reaction. The rest I'm totally with you. I just wanted to mention to complement sort of what Isabel mentioned, but also to one of the questions in the chat, that it's so important, as also Santiago highlighted, the importance of start with cannabis now, that most of the seizures of the police are still cannabis. and 40% of those seizures are actually below the minimal doses. So we are basically spending resources in places that we shouldn't be doing it. Right now, 4,000 police members are in charge of the anti-narcotics police force, and we need to start thinking about what are going to be the new activities of those police members and how they should be oriented toward dismantling this criminal organization and not, as Isabel was saying, just pushing for seizures at the street level or going after the people who are harvesting those plants. So, I mean, I'm amazed that 40% of the seizures are below, the minimal doses. We're just doing the wrong thing there. So yeah, those are my reactions for now. I don't know if we want to go through the questions, or I don't know if Isabel wants to react also to Santiago's points.
Thank you, Maria. Yeah, why don't we let Isabel jump in again? And there are questions, and I'm sure Anna also has some questions, audience questions. But Isabel, please.
Thank you. And thank you so much, Santiago. I share the personal sentiment of Maria Alejandra. We are quite frustrated because it's been 2 months maybe. And we've sent out the memorandum via official channels and many other channels to the Ministry of Foreign Affairs, to Justice, to whoever we know might take use in this and build on this, and we've received no response. So thank you, Santiago, for reading us and for feeding into it. I do believe that some of the conversations are in progress, and we'll continue to have those. In terms of revenues, I've been thinking about this because at Dejusticia, we've been working on some ideas on how fiscal policy can feed into cannabis regulation, and the issue about revenue and how it could be a source of income for the state is a great opportunity. But then in the same sense, there is a tension, and especially in the Colombian context where retail price is so low that if we tax within a regulated market so high, we will not be able to compete with the illicit market. So, and I do believe this is a conversation where we welcome economists to jump in and really have this discussion. Where do we find that spot where we allow to have revenue, but do not feed the poor population into the illicit market because they just cannot afford to go into the illicit market? And that also becomes a public health issue as well. So this is a question that we'll continue to have. In terms of building and how cocaine regulation should be fed also into an expert consultation and dialogue, I fully agree. And then there's also another issue of how far can we go within the limitations of the treaties. And this is something that no one really wants to talk about because one thing is that Uruguay went ahead and regulated cannabis, being Uruguay and being a small country and being not an exporter country. What will the conversation be at the international level where a country like Colombia decides to regulate the product that it exports and that it does go against the international treaties? So we really need to open up that uncomfortable conversation. And I do believe that's where not only the expert consultations, but also conversations with high-level EU officials and US officials, like, as you mentioned, Santiago, broaden the discussion outside of the UN fora and into bilateral diplomatic discussions. Then the issue about reparations, compensations to producers, I do understand the difficulty because marijuana markets are highly specialized. And they should be, like, it's something that really needs to have the sort of quality control that allows to protect public health. I think that there is space for the two tracks. I mean, for having the idea of social justice materialized through prioritized licensing or through prioritized development to those areas. And it can be complementary even. Not everyone who currently grows marijuana may want to be part of the legal market, or they may want to be. It's up to whatever happens. What does need to happen is that, at least in my point of view, is that the regulation of cannabis should prioritize specific interventions in terms of rural development to those regions, because the socioeconomic gap that prohibition has left could be in a way repaired by prioritizing those regions through socioeconomic and rural development. Then if licensing and prioritizing licensing to some of those groups can be a parallel track, that can also be an option, not an exclusive option or a mandatory option, but just a track, like if you think about different tracks. And this relates also to the issue you mentioned about market structure, which I completely agree with, that we have very obscure data and we need more information. And that can feed into regulation in the way that you mentioned, but also into who do we want to incorporate to the legal market? It's not only growers, it's also low-level dealers who are not like the big narcos, who are not the Pablo Escobar, they were like street youth and barrio people who were having an income from being a salesperson. How can we get to identify who that population is, who they are, and try to get them into the regulated market? So market structure research can lead us into that. That'll be all for now, but I think it's a very interesting conversation to be having. Thank you.
Santi, did you want to come back for another round?
Sure. Yeah, I think like I knew the first point that I raised on compensation via overregulation will be a bit will give food for discussion. I think there's something that we definitely need to do. My only concern there is that I'm not sure in the long run it is beneficial even for the same communities. So this is why I think about like other like mechanisms that are like more transparent, such as just maybe subsidies or something like that. I would say like more alternatives to decide whether or not to do this. Did you lose me? I think, but can you still hear me?
Yes,
Okay.
we have you. We have you.
All right, so that's one point. So yeah, I know it's a challenge, but it's also I know there are like, and this is why I actually at some point I put that I mentioned that this discussion on cost benefits of legalizing cocaine should be brought via different, or should be analyzed through the lenses of different normative frameworks, because I think we don't only need to be like utilitarians or utilitarian here, but rather think about like historical depths with some communities and move us away from only market efficiency and think about how to actually like compensate, for instance, these communities. So I do think that there's like something to discuss there, but I agree with you, Maria, that I mean, it's not an easy thing to just decide. And maybe to react on one of the points that Isabel raised, this last one on trying to bring people from the unregulated to the regulated market. I think the same logic applies to me. If we think about getting one of these kids that's just selling like retail drugs in one neighborhood in Bogota or Medellin, trying to move this person to the regulated market. I think once the market is regulated, the largest pharmaceutical companies will already have all the capacity to implement like value chains and retail markets, and we'll have like I don't know, many ways to, and this is pretty much what happened with marijuana in some states in the US. So I'm skeptical that some of them or many of them would be actually incorporated into the legal industry. I think it mostly applies to production because there are like comparative advantages to grow coca in some parts of the country where some people is growing it. So it's hard to just displace that from one day to the other. But the retail markets are harder. So I think I would wish that to happen, but I think that's also hard. This is why I think like in the end, you may think of using maybe some of the revenues, tax revenues out of this, if this is actually feasible at some point. Some of these tax revenues to also maybe have different programs, maybe direct compensation, maybe infrastructure, maybe access to labor markets, training, like many other forms of intervention with these communities, so that people can, if they end up working in the retail drug market, they They did that because they just had like a better training rather than a more like state-oriented like a transition from the illegal labor market to the legal labor market. So I think that in the end, like the challenge here is that too much regulation might backfire, but too few regulation might be very like dangerous, right? So what's the key point where we should like get at? That's one important question. And this is why I think, and also like María Alejandra and Isabel said, like starting with marijuana is kind of the easy, natural next step. Like it's really incredible to me that we're still having these conversations about marijuana while there are like so many like unregulated drugs, like this, something that's in Colombia, it's like now widely used, especially in Medellin. I don't know if in other cities, they call it like a pink cocaine, like Tusi, which is not cocaine. It's just a mixture of whatever ingredients you can imagine. It's actually like no one understands what's in it, and it's very dangerous. And we should be focusing on that rather than thinking about whether or not marijuana should be legal. Yeah, and maybe just to elaborate again on one point, which is how like many resources of the criminal justice system get released because of regulation. María Alejandra mentioned that 40% of seizures are like drugs below the minimum dosage. And just for people to understand what this implies is like every seizure is at least 8 to 12 hours of at least 2 patrolling officers. This is a massive amount of police time. And this creates an additional pressure on prosecutors, judges, and many others within the chain. So it's massive resources that we're devoting to something that I believe should not be a priority now. While the clearance rates for homicides in Colombia are not even close to 30%. So we definitely need to redefine priorities, and one way to do that is to change our approach to drug policy. I'll leave it there, Ken. Thanks.
Great, thank you. So I'll ask a couple of questions, and then Ken may have some, and then we'll turn to some questions that have already been asked by the audience. So thank you again, everyone, for these really great presentations and for the debate. A first question that I had is sort of thinking about international relations, about the just very important role that the US plays in Colombia and how it is like a shadow that sort of shapes a lot of what the government can do. When we think about changing the goals of policies, especially regarding coca, for example, and cocaine for the short term, I think Isabel mentioned that the goals need to change, right? And this measure of reducing hectares of coca plantation in half is the wrong goal. I totally agree with you. Have you thought, and you as Isabel, Dejusticia, or the different organizations when you were discussing the memorandum about alternative goals? And is there like an agenda of talking to the US and maybe the UN, but especially the US, in terms of what should the sort of short-term goals be? If we have not legalized yet, we are still sort of under the prohibition model, but what would make more sense? So that's one question. The second question is sort of about, so you mentioned the international treaties and how, of course, this would violate a lot of these treaties. It creates all kinds of problems. But I also was thinking about this asymmetry that we have in the discussion on drug policy in international spheres, where there are many amazing organizations pushing for reform, but a lot of times, most of the arguments are based on the rights of consumers and the situation of consumers. And Latin America, of course, has an issue with consumption, but we pay the price of lives because of the illicit markets in a way that no other region in the world does, right? Do you see any specific recommendations, or do you have any ideas of how to try to push this discussion forward in this international arena where Latin America has a voice that is more consistent with the size of the costs that the region is bearing? And then the last question, going sort of back more to more local or national issues in Colombia, do any of you have a sense of where public opinion is on these issues, right? Because this is a huge issue, of course, for politicians, How do we educate the public? This is something we talked a little bit about in some of the initial things we did with Redestal. We were trying to think about the role of scholars and research. And one of those goals or one of the functions that we have to play is just disseminating research findings. And I know CECET does that, I know Dejusticia does that. But do you have a sense of how public opinion is changing? And do you have any recommendations for the government as well? If the Petro administration really wants to push this discussion forward, it really has to educate the public, which still seems to be, or used to be at least, very conservative. So those are 3 questions. I don't know if any of you wants to start.
Should I?
Go
So
ahead.
you want to start? Should I? I mean, Anna, you know that my expertise is not in international relationships, but I will want to react to some of the ideas. And since we did this memorandum with a lot of session of agreement, I think that our responses will be at the personal level. So this is not the organization responses because we haven't thought about this particular question maybe. But I think that one thing that we didn't mention with international relationship is the need of I think building a bloc with Bolivia and Peru. I think that Colombia cannot be alone in this conversation, and we need to make a bloc, an agreement, a fight with them, and that's something that President Petro should lead, and there is the momentum for doing that because of the type of government that we have right now in place. So I think that also within that bloc, and again, I'm not an expert, but I think that there is room for interpretation of the national conventions as well. As I know Uruguay is Uruguay, as Isabel said it, but I think that we have to push that agenda, at least with the coca leaves to start. I mean, I can't believe that we left Bolivia alone with the fight of the coca leaf, and Colombia has not joined that fight to take out the coca leaf of the 1961 convention. In terms of new indicators, and in particular with the relationship with the US, I think the environmental goals is something that we can agree upon. I do understand that hectares shouldn't be the focus, but 50% right now of the coca hectares are in places that are strategical in environmental terms. And either coca or cacao or coffee shouldn't be there. So it's not because illegal or legal, it's because it's a crop that is pushing the forest, basically. So I do think that we can agree on environmental goals, but agree. And I think that the focus right now should be on contention of the coca leaves, not in the reduction, but on contention. Like, how can we agree with the social agreements and with social monitoring that coca should not be expanding on those places? So I think that if they're gonna keep doing substitution programs, the agreement should be on not expansion rather than reduction of what is happening right now, because we need a gradual transition. I think on the public opinion, I mean, I don't know data about just what some newspapers or media have shown. I think there's still a lot of resistance about legalization, even in Colombia, even of cannabis. So I think we have a lot of work on that. And I think we have to start working on other things, such as changing the narrative of who are the coca peasants or the marijuana peasants. I think that in the public opinion, there is still a lot of stigmatization about these communities, and also to other members of the value chain, as Isabel was saying. So I think we have to still do a lot of work on the stigmatization of who are those participating in this illegal value chain. But I don't know if we have data on public opinion regarding that. Now, the president who won the election is the person who was pushing for a new drugs reform. So at least I will say more than 50% somehow agree on that. Although I have to say that Petro has changed a bit his speech, and they have now said many times that cocaine legalization is not in the agenda in this government, which is, I think, is a pity, because I can believe that they are not. I understand, we already said that we cannot legalize tomorrow, but this is the government that needs to start designing the institutions and the environment to do that. And it's very surprising that they have mentioned in the last week several times that it's not the priority of this government. So if that's not the priority or the goal, then I don't know how they're going to change the war on drugs. So I don't know. That's my reaction.
So quick reaction to these three questions. With regards to indicators, I'll just share over here because I remember there was a paper with a suggestion of a framework. It's from the International Peace Institute, and how to frame indicators within the SDGs. And there are some ideas there. But I think, and listening to María Alejandra, it's where we come to the challenge of what indicators would work in the case of coca crops located in, or populations located in environmentally sensitive areas. Because in general, you'd say, change an indicator that tells us about socioeconomic development. So if land titling increases, if access to basic services increases, then you'd get a general sense, but that will not apply to the percentage of populations that are within national parks and reservations and so on. And I think there is a risk there in what indicators to put forth. The US strategy now does have the counter-narcotic strategy states that environmental crimes will be part of the agenda they'll be documenting. So are we in the risk of transitioning from a war on drugs to a war on deforestation, where the same methods of criminalization of low-level populations are being used? That actually happened in recent years. So Operación Artemisa, which is a military operation in the previous administration, supposedly to protect the figure of a Supreme Court ruling that stated the Amazon is I don't know how you say that in English, sujeto de derechos. So it's a subject of rights. And what Operación Artemisa in the end did was criminalize campesinos, but not really go after land grabbing full-on operations. And I think we really need to take caution in if the redrafting of indicators does incorporate, as it should, environmental concerns, that it does not translate into the same tactics and mechanisms that can criminalize peasants. I think the issue is how to stabilize populations. Okay, they're already within areas that are sensitive, how to stabilize them there so that they don't move further and further and further into the agricultural frontier. And that goes, I believe, into what María Alejandra said about we need to contain. Not for now, it's not realistic to reduce. We need to contain what is happening right now in order not to move further within the Amazon and in other ecosystems in the Pacific region. For the second question about how there is sort of like a dissonance between drug policy reform from the so-called North and drug policy reform from the so-called South. So you go to the UN and there's this whole advocacy about the rights of people who use drugs and the networks of people who use drugs. And for example, in Canada, there's a lot of movement around safe supply. And I listen about just the term safe supply. Safe supply is framed within the substance that the people who use drugs receives, but it is never framed about where does this come from and who is behind the production of this, and are they safe in the production? So I think these are questions that as a movement, less into the academic sphere and more into the movement field, we need to be asking ourselves and asking uncomfortable questions. Does safe supply include safety for the other end of the spectrum? And I think for now, the conversation has not included that. So thank you, Anna, for asking that. And then thirdly, about public opinion, I don't know either. I think that usually in the LAPOP surveys, they do include some questions on that, but I don't have those numbers with me. They should be there somewhere. I am concerned about the fact that I see a risk that in 4 years we'll have a backlash. Like we get to some place where we have some drug policy reform and then there's a backlash, and how will this pan out? So building public opinion, it's crucial to really gather support for the sustainability politically in the long run of this. But I do see some shifts. When you think about maybe 8 years, like 10 years ago, there was no way cocaleros would speak publicly about being cocaleros. And now they're more open about their movement, their agenda, their identities even. It is still very much stigmatized, but I do believe that the peace agreement made enough space for this population to come forward with their realities. And you see them in public fora, and you see the Cocalero movement present and visible more than they were before the peace agreement. I don't know if I'm being too optimistic on that, but I do see that there's a bit more visibility.
And I'll maybe just react to your first point on the goals, like what should be the goals. I hear I'm like more pessimistic. I honestly think that in the long run, the only way to protect the environment, to like control how much hectares are devoted to coca crops and so on, is legalization. So the quicker we get there, the more that we will protect the environment, the more that we will protect communities and so on. And the reason why I think that is that, like any goal, like you name it, like we have, maybe the current goal is to reduce by 50% coca crops. So let's say it's not 50%, let's say it's 10. Let's say it's for that not to grow. But this is the supply. This is the starting point of the value chain. This is the starting point of the supply. The demand is relatively stable and rising some years. And this is a very inelastic product at every stage of the value chain. So any shortage of supply would, in theory, and there's there are actually like theoretical papers on this, increase the incentives for entry into the market via violence and coercion, and to compete for the market, and would increase prices and so on. And then there's also, like I mentioned, in theory, this would happen, but there's also now like some empirical evidence on this as well, like shortages of cocaine being shifted from, being sent from Colombia to Mexico, create violence in Mexico because it raises prices, it raises competition and so on. So I think that if we think about like a harm reduction goal, if we can talk about something like that, would be maybe what María Alejandra mentioned, like let's agree with the US or maybe others not to have more crops than what we have now. I think the less ambitious the goal is, the less violent will turn the market if we succeed into meeting those goals. So this is really, really, I would say, una encrucijada. I don't know how to say it in English. Like, I think there's no way out. I think the only way out is legalization. So the quicker we get there, the better. That's one point. And the other is, I also feel sometimes that countries, some other nations are a bit unfair with Colombia in terms of how, like, what we have to do and what they do. And I'll just mention one example. I was in a conference in Geneva like 3 weeks ago. And after the conference, the organizers took us out to just walk around Geneva, and I asked them about like drug markets. I asked them about like local retailers, and they said, yeah, of course we can. I mean, of course there's a cocaine and marijuana market here that's booming. And of course, and you can buy in that corner, in that other corner, and they already knew. And I said, like, okay, and what do the authorities do about this? No, they also know. Everyone agreed on just allowing the market to be there, informally regulated via just informal conversations with retailers about reducing violence, for instance, and so on. But while many like developed nations do that, we are forced to just go with all the feast of the state to try to reduce supply, which is a very like, it's a textbook example of a policy that should not work. reduce the supply in a very inelastic market, meaning like no matter how high the price is, people are still going to buy. So any shortage in supply will increase prices, which will turn into more competition and violence and so on. So yeah, I think if we think about the goals, we should try to think about these goals as harm reduction goals. Like what goal would do the least harm to Colombia and also to the other like countries that are part of the value chain, like Brazil, countries in Central America, Mexico, and so on.
Great, thank you. Ken, do you have any questions?
Well, I thought maybe I would go to one of the audience questions, which has been touched on by each of the panelists to a degree, but I think it's a question goes straight on, and I'll just read it as it's written. It says, the money at stake for the current high-level illicit suppliers cannot be replaced in a legal market. Any thoughts on what these groups will do, especially if they are not allowed to participate in a legal market? What alternative products, market schemes might they move into? And what are the unintended risks that could result from this? Anybody want to take a first stop at that? Santi.
I can jump in. Yeah. So
okay.
I think like, I think there's no like silver bullets in terms of like moving us towards development, nations such as Colombia. So I don't think legalization will just like lead the whole apparatus of the criminal market that today runs the market into the legal sector. So I think that's not realistic. I think that it's not going to happen. But I do think that, and maybe I mentioned this a bit in my discussion, that the size of the criminal market would decrease, and the size of the legal economy will increase. So this, in general, should move some people, at least on the margin, like from one sector to the other. So some people that participates in the illegal market today should, in principle, like move to the other. I think there are risks on moving to other illicit rents, and for instance, extortion. But I think that this would also, like legalization will also allow the state to refocus on what's important. And let me just elaborate a bit on extortion. Extortion, I told you before, so I've been mostly studying the local criminal market in Medellin for the past 6 years. And there are like 400 gangs, street gangs, regulated by these other like meso-level organizations that control them. And the two main sources of income for these street gangs are drug sales, both marijuana and cocaine, and extortion. But the idea that the authorities have on how extortion works is completely obscure again. In a city such as Medellin, there are roughly 400 reports on extortion every year. And in a survey that we ran in 2019, we estimate that there are roughly 7 million transactions per year of extortion payments. So I think that even if some groups shift to these other activities, the more resources and the new focus that the state will have should allow the state to understand better these other problems, like other illicit markets that are not to be regulated. I mean, we're not going to legalize extortion, never. But we do need to strengthen law enforcement into that direction, understand those markets better, and so on. So I think this will happen for sure. I think so. What will happen is that some groups will, or some people will turn to other criminal markets. I don't think everyone will. So that's one a positive side on that. And the other one is that the refocus of the state should mitigate the problems that are associated with this.
Thank you, Santi.
Can I?
Yeah, please jump in, please.
Yeah, I would like to also add to this point that any form of regulation has to come with the presence, the integral presence of the state on the territories. Otherwise, I think it would happen what is going on right now, for example, with gold market. You know, gold is legal or could be legal. And in Colombia, I think something like 80% of gold is illegal in basically the same areas where coca crops are produced. And even though it could be easier to legalize that market, it's still illegal, informal, etc. So, and that's because it's not enough with having the framework of regulation, but it has to come with all the battery of the states. So I think that, of course, we all agree that if regulation happens tomorrow, criminal groups are not going to disappear. They're still there. They have all the structure. But we're going to also, Santiago explained, reduce the illegal rents. Some of that illegal groups will actually start joining the legal market. But in order to sort of complete the circle, we need the battery of the state in the territories in Colombia where those things are produced. Otherwise, we will end up with, like, we have the gold market right now, which is, I think, for me, like the reminder of how things can go wrong with coca and cannabis, is that if we don't have the presence of the state, like an integral thing, even with a structure to regulate a market, it won't happen. So it's a very complex scenario, but we have to start somewhere, because as Santiago said, anything is better than the status quo. So any little steps that we do, we move forward to a setting to regulate the market.
Thanks, Maria Alejandra. Isabel, did you want to jump in on that, or you're happy with what you heard? Yeah. I just want to ask one question and turn it over.
Sorry, Ken, I wanted to add something
Sure.
on this point. And I think there are historical examples that we can think of to think about some of the ways in which legalizing a really profitable illicit market eventually really weakens these organizations. And so, for example, prohibition in the US created this very powerful and very, very rich mafia. And when alcohol was legalized again, of course, they didn't disappear. And that would happen in Colombia or anywhere where you have this perverse human capital that has accumulated this know-how. And of course, it's not going to disappear. It may go into other illicit economies. Some, of course, may go to the legal market, but of course, it will continue. But one of the main points is that if you're removing a lot of these profits, they are going to get weaker and they are going to be less attractive to new participants. And eventually, it's going to be easier to dismantle the organizations or for them to sort of naturally fade off, right, and disappear. So there are examples that we need to look at to sort of understand these processes and then to think about additional ways in which, with policies and prevention, and with young people, for example, with youths who may go into these organizations, how you can accelerate that process.
Great. Thanks, Anna. I have one question. It's a little bit to the side of what the meat of what we're talking about today, but I can't help but ask it, given the comments that everyone has made or the panelists have made, is it's very clear that in the current government, Petro government, the view, or certainly it was as it articulated, that you couldn't have paz total. You couldn't reduce the killing of social leaders. You couldn't have agrarian reform. You couldn't have any number of things, environmental protection, without dealing with the drug issue, correct? If I'm not mistaken. And yet, what you say is over the last several days, I'm guessing, that there seems to be a bit of backing off. Now, on one hand, there is sort of a murmur of low-level criticism that I think, as Isabel had said, we're into almost 90 days now into the new government, and not much seems to have happened. A lot of things haven't sort of jumped off and arrancado. They haven't just sort of started to move forward. Is the thought that this drug reform lack of movement so far and the lack of recognition of the work that memorandum has done, and Maria Alejandra, or sort of acknowledgement mentioned, is because it's tied up in that same lack of movement forward as some people might perceive on generalized for the new government? Or do you think there's a rethinking of the critical aspect of drug reform as it relates to all the kinds of issues that I just mentioned that President Petro wants to accomplish? What do you think, Maria Alejandra? You're on the front lines of this conversation.
This is hypothesis, right? Because I don't know really what's going on. I mean, my hypothesis is that there was a, you know, let's put it this way, like a phone call from the US, like, okay, what is the plan? Like we are not, I mean, I think there has to be some pressure from the US. That would be my guess. And that's why they back up. I mean, the announcement of we're not going to do legalization and we are going back to substitution, even we're going to force eradication in big farms or big industrial coca crops, was right after the meeting with the Secretary of the State, I believe. So I think there was a backup because of international US pressure. Probably there is something also to do with they're just getting organized with everything else. So it's not only drugs, it's everything that they're putting together. But I mean, drug agenda was so central in this, in the narrative, even in the inaugural speech, that I'm just amazed that nothing else had happened. For example, one detail: if crop substitution is going to be the main thing, which is not new, at least they haven't announced the new director of that agency to start adjusting. In the meantime, you know, the whole Cocalero movement is like, okay, what's gonna happen? How are we gonna move? So I have opened up some participation forums, but like right now it seems that rural development is going to be the focus, which it's okay. We have to do so many things with or without coca that it's anyways a good plan, but they haven't announced it how. So that just surprised me. So that part, I think, is just part of the starting of the government that is just slow. But I think that there is some questioning about the US, and that's why those bilateral relationship in renegotiate the indicators and the goals needs to happen now, because, you know, the goal, as Isabel mentioned, it's 50% of reducing of hectares by next year. That's not going to happen. So if we don't renegotiate, we don't talk about that, we are going to be, ¿cómo se dice? Desertificado. So we need to
Certified, correct.
Certify, yeah. We need to discuss that point. Otherwise, we're going to be in trouble in our US relations.
Thank you. Thank you, Maria. Isabel, I mean, the one question I would ask is, maybe I read it a little bit incorrectly, that when Secretary of State Blinken was there, he seemed to open the door for the US being amenable to considering other ways of dealing with the drug issue, which it seemed to me a way of, as far as politically he could go without basically endorsing what Petro was trying to do. But Isabel, I see you shaking your head. Yeah. I think it's yes. I don't think you're shaking your head no, but go ahead. Either way, the floor is yours.
So all of this is speculation, but when you go back and look at the election process, although they were very strong, I mean, Petro and Francia were very strong on speaking about a change of approach and a change of approach towards drug policy, they never really spoke about regulation. So when that regulation announcement came, when they came into office, it was like a bomb went off to the US. And we tend to forget that. Petro is going to be progressive in terms of drug policy. He never spoke about regulating cocaine when he was a candidate. He never did. He's never endorsed it publicly. So we need to be mindful of that. And then I think the other issue is that it was never a priority in the shortest term. He was clear to present the tax reform, and that was going to be the #1 priority. And then all else, kind of, my speculation is all else is falling into the leadership of the ministry in charge of that. But because, and as we stated in the memorandum, there's such an institutional dispersion of the drug policy issue, so there is no high-level official with a powerful enough voice and interaction with the president to move forward with anything. With land reform, you have a Ministry of Agriculture such as Cecilia Lopez, who has the leverage and the interaction with the president to move forward with decisions that can be controversial, and we can discuss them elsewhere, but there are developments. With this, who is the authorized voice of this government speaking on drug policy? There is none. So I think what is happening is that they are aware of how politically sensitive it is and how it needs to have endorsement of the president himself to move forward, but that can lead to a paralysis. And that is perhaps what's going on.
Yeah, interesting, because part of the coalition, of course, you have ex-President Gaviria, who's been clamoring for radical, if that's the word, drug reform, right? So there are people in and around the government. Obviously, former President Santos has been leading this as well. Santi, did you want to respond to this?
I won't repeat what Isabel and Maria said, but I would just reinforce that this is the elephant in the room all the way. Like, I think like state capacity in Colombia is completely determined by the current policy, because these are just massive rents in territories, not only like in Tumaco, but also in Medellin or Bogota. Like, we have corruption everywhere. We have like all these challenges. And I think that to me, it's also disappointing, because I think that if there was some government in Colombia that would move forward this agenda, would be this one. And I think that I would love to see something moving ahead there. It's frustrating what María Alejandra mentioned at the beginning, and also Isabel, that no one has replied. No one from the government has replied. Many people in key positions have not been named. And also, I think, and I worry about this a lot, like, for instance, this idea of total peace or paz total is not a structured policy agenda. It has more ingredients of a speech rather than an actual plan that's implementable. As the guidelines that Isabel and María Alejandra and others prepared for the Colombian state, which is a plan that's implementable, that has a clear path, that has a clear roadmap. I think we might end up being just trapped by speeches, and in 4 years, maybe more people will be resistant to this type of policies, because I don't know how many hectares of coca we'll have, and maybe we end up with stronger criminal organizations, because I think what Anna mentioned before, that's related to what I also try to emphasize, but I think Anna put that in a much more clear way. The size of the revenues for these groups are the determinant of their capacity to fight, to diversify. Like, for instance, and María Alejandra touched a bit on this also, like this problem of illegal gold mining. I think it's also clearly related to our policy on drugs, because if you are producing drugs in Colombia, you need to develop such an enormous coercive capacity that then diversifying to other criminal markets is very easy. So probably we wouldn't have as much illicit gold production absent the policy of prohibition. So yeah, I don't know. Maybe I'm just like pessimistic now about this. Thanks, Ken.
Perfect. Thank you so much. Thank you to all the panelists. There are a few questions that we didn't get to in the Q&A. I briefly wanted to mention, because I realized that for some people who don't know much about coca in Colombia, that the coca leaf is also used for medicinal purposes in Colombia, in Bolivia, in Peru, and it has many uses that are being investigated. And I'm happy to answer some of your other questions. I know the person who has some of these questions is contacting me via email, so I'm happy to refer you to some of the work on these issues specifically. So I wanted to thank you again, the organizations that put together the memorandum, María Alejandra and Isabel, for coming together. With the Council, the Canadian Council for the Americas, we are putting together a couple of next series. The next one, we will be talking about how to think about drug policy reform with Latin America as a bloc, like what makes sense to push for and what are the sort of the steps we have to take to facilitate that. And a little bit also about the role of research and evidence and academic work for learning more about this and thinking about the debate. So please stay tuned for the announcement. This will be in the second week of November. Thank you again, everyone, for joining us. And thank you, Santiago, for your fantastic comments and the debate.
Thank you.
Thanks for the invitation. Thank you, Ken and Maria.
Thank you. Gracias. Ciao.
Bye.